Hi everyone, it's Danielle and today I'll be discussing asthma. So what is asthma? Asthma is a chronic disease that is characterized by airway inflammation, reversible airway obstruction, and bronchial hyperresponsiveness. It is actually the most common chronic disease in childhood. There are many factors that can contribute to asthma, such as environmental allergens, such as dust in your house or the fur from certain animals like cats and dogs. Even allergens from cockroaches can contribute to asthma, as well as obesity can also contribute to asthma. Certain viral infections can contribute to your symptoms from asthma. It can also be exercise induced when you're hyperventilating that can trigger an asthma attack as well as certain environmental pollutants such as tobacco smoke can also contribute to asthma, even based on the occupation that you have. If you do a lot of painting or farming, all of that can contribute to asthma. There are many more factors that can contribute to it, but those are just a few. The signs and symptoms of asthma include wheezing, coughing, shortness of breath, and chest tightness or pain. The severity of asthma can be classified as intermittent or persistent. I'll break it down based on the symptoms. So for intermittent asthma, you have less than or equal to 2 symptoms for the week. For persistent, it can be broken down into mild, moderate, or severe. For mild persistent asthma, you have greater than 2 signs and symptoms for the week, but not daily. For moderate persistent asthma, you have daily symptoms. And for severe persistent asthma, you have symptoms throughout the day. Yes. Patients who have persistent asthma should have allergy testing done because environmental allergens actually play a strong role in the symptoms exacerbation in asthma. Therefore, if you have allergy testing done, you can know what it is inside your house or wherever that is triggering your asthma attacks, and you can try your best to avoid them. So it is important to have allergy testing done to identify what are the allergens that trigger your attacks. In terms of the treatment of asthma, all asthmatic patients should have a rescue inhaler. The one that is commonly used here in Grenada is the Ventolin inhaler or the albuterol. Right? Everyone, all asthmatics, should have that inhaler in the event that they have an attack, they are not close to a pharmacy, they are not close to the hospital. That rescue inhaler can save their life. So once you are an asthmatic, ensure that you always have your rescue inhaler, your Ventolin inhaler, and that you never run out of it, and that it is always on you or close to you. Patients who have persistent asthma, as I would have classified it for you before, persistent can be mild, moderate, or severe, will need to be on some long-term control for their asthma, which is usually an inhaled corticosteroid. Here in Grenada, we usually use Vicotide, but all patients who have persistent asthma should have some means of long-term control for their asthma. Most of the time, it is an inhaled steroid, and if it's severe, you might even need to add a long-acting beta-2 agonist such as salmeterol. So my advice to asthmatics, like I said before, always have your rescue inhaler. At home, you try to avoid dust or anything that can trigger an attack. If you have to clean for whatever reason and you can't avoid the dust, please wear a dust mask to prevent any dust from getting into your nostrils. Also, if you have any pets, try to avoid those pets coming into your room. Don't let the pets go on your bed or anything like that. You have to be careful with certain carpets that have a lot of furry, feathery things that can trigger your asthma attack. Also, if you notice that you have severe wheezing or that you are wheezing and you're using your rescue inhaler and the rescue inhaler is not working, you have to come to the hospital right away or call the ambulance right away. If you notice that your lips or your nails is getting blue, come to the hospital right away or call the ambulance right away. If you are walking and talking and you are getting short of breath, come to the hospital right away or call the ambulance right away. So you have to know when your symptoms are severe and it is not relieved by your rescue inhaler that you should seek medical attention right away. So I hope this video has been informative. I know it's been short and there's not much that I discussed, but I discussed the things that I think were important for you to know. Bye, and I'll see you in my next video.